1. Ureterocele. Cystic dilation of the distal ureter within the bladder, often associated with ureteral duplication. Ultrasound characteristics. Anechoic, round, thin-walled cystic structure at the ureteric orifice. May cause hydronephrosis or hydroureter. Clinical symptoms. Urinary tract infection UTIs, dysuria, incontinence if ectopic. Scanning tips. Assess both ureteric orifices. Use colored Doppler to check for normal urine jets. 2. Ureteral duplication, duplex kidney system. What it is, a congenital anomaly, where a kidney has two ureters complete or partial. Ultrasound characteristics. Complete duplication. Two ureters drain separately into the bladder, often with an ectopic ureter or ureterocele. Partial duplication. The ureters merge before entering the bladder. Upper pole may show hydronephrosis due to an obstructed ectopic ureter. Clinical symptoms. Recurrent UTIs, incontinence if ectopic. Scanning tips. Scan for two separate ureters from the kidney to the bladder. Check for associated ureterocele or hydronephrosis. 3. Ureterectopia. What it is, a condition where one ureter does not insert into the bladder normally, e.g. into the urethra, vagina, or seminal vesicles. Ultrasound characteristics. Hydronephrosis or hydroureter of the affected kidney. May see a non-functioning renal segment due to obstruction or dysplasia. Clinical symptoms. Continuous urinary leakage, especially in females. Recurrent infections. Scanning tips. Identify the abnormal ureteral insertion site. Assess for hydronephrosis and bladder abnormalities. 4. Vesicureteral reflux, VUR. What it is, retrograde urine. Flow from the bladder into the ureters and kidneys. Ultrasound characteristics. Mild cases may appear normal. Moderate severe hydronephrosis. Dilated ureters, bladder wall thickening. Clinical symptoms. Recurrent UTIs, fever, voiding dysfunction. Scanning tips. Use colored Doppler to detect refluxing urine jets. Measure residual urine post-void. 5. Ureteropelvic junction, UPJ obstruction. What it is, blockage at the junction between the renal pelvis and ureter, leading to urine buildup. Ultrasound characteristics. Dilated renal pelvis with no ureteral dilation key finding. Thinning of renal cortex in severe cases. Clinical symptoms. Flank pain, especially after fluid intake. Recurrent infections. Scanning tips. Assess kidney size and cortical thickness. Look for peristalsis in the ureter. To rule out other causes of obstruction. Sex, urolithiasis, urinary stones. What it is, stones anywhere in the urinary tract, including kidneys, ureters, or bladder. Ultrasound characteristics. Hyperechoic focus with strong posterior acoustic shadowing. Twinkle artifact on colored Doppler helpful in small stones. Hydronephrosis or hydroureter if obstructing the ureter. Clinical symptoms. Renal colic, severe, intermittent flank pain. Hematuria, dysuria. Scanning tips. Adjust gain to enhance posterior shadowing. Use colored Doppler to detect twinkle artifact. Check for secondary hydronephrosis or dilated ureter. 7. Bladder diverticulum. What it is, outpouching of the bladder wall, leading to urine stasis. Ultrasound characteristics. Anechoic pouch communicating with the bladder lumen. No bladder wall thickening at the diverticulum unless infected. Clinical symptoms. Recurrent UTIs, difficulty voiding. Scanning tips. Differentiate from adjacent cystic masses. Assess for stones or infection in the diverticulum. Oita, bladder tumors e.g. transitional cell carcinoma, TCC. What it is, malignant tumors arising from the bladder epithelium. Ultrasound characteristics. Irregular, hypoechoic, or isoechoic mass in the bladder lumen. No posterior shadowing differentiates from stones. May have vascularity on color Doppler. Clinical symptoms. Painless hematuria, classic sign. Urgency, frequency. Scanning tips. Use colored Doppler to check for vascularity. Scan in multiple planes to confirm the mass is fixed. 9. Bladder outlet obstruction, BU. What it is, blockage at the bladder neck, leading to incomplete voiding. Ultrasound characteristics. Thickened bladder wall, 3 ME. Post-void residual urine, 100 millimoles. Trabeculations. Clinical symptoms. Weak stream, hesitancy, retention. Scanning tips. Measure pre- and post-void volumes. Check for associated prostatic enlargement in males. 10. Neurogenic bladder. What it is, bladder dysfunction due to nerve damage. Ultrasound characteristics. Enlarged, thick-walled bladder. Irregular trabeculated wall appearance. Large post-void residual. Clinical symptoms. Incontinence, retention, recurrent infections. Scanning tips. Measure bladder volume before and after voiding. Look for bladder wall thickening.